Hello, this is Dr. John Hart, your instructor for the course Stats for Healthcare Professionals. And we're looking at Module 2 here. And you can read over the introduction and overview and reading. We'll take a look at the assignments here. 2.1 Interpretation of Graphs. And we can come down here. It's about looking at ages in 1970 and 2020 of the population in the U.S. And here are the graphs you'll be looking at. And the vertical axis is here. Horizontal is here, sometimes called the x-axis, sometimes called the y-axis. So we see it's labeled age. Down here, we see that it is population. Only 10 people here? No, let's read on here. In millions. So this bar is sticking out the farthest, isn't it? So that means this age group, we can look over here, it's about 10 to 15. Has the most of any age group, a 5-year age group or so. And it's just a little over 10 million, so getting larger as we go this way. Getting larger over here as we're going that way. Different colors, males here and females on this side. So we can see there's more younger people than there are older people. And that is 1970. And the second one down here is 2020. Same setup though. Looks like the bars come out farther. So that means more older people is a difference between the 2 years, 1970 and 2020. Some similarities though. The very old people there's the fewest of those, just like in 1970. So it does not look to be a bell-shaped curve. Bell shape would be high in the middle and then tapering off at the ends. It's tapering off at this end, but not at this end. Usually charts are standing up, so to speak, so it's more of a bell shape without turning your head to get your bearings. And if you want to see the actual numbers, so I was guesstimating that 10 to 15, sticking out the farthest there, has about 11 million, 10 to 15 for males, and about the same for females. So we can come down here for 1970, 10 to 15, and close. But we can see that group is the largest for both genders. And in 2020, it looks a little more round, a little more symmetrical compared to 1970. We have this tapering off here that we don't see as drastic as we see up here. But 2020, it kind of tapers off a little bit. Like up here, this tapers off a little more. And same with females. So that is that assignment. In short paper guidelines. Describe the axes, that's the Y and X, shape and center, went over that. And you can look at the chart or the table to answer this about age, comparing the two different years. So we've got male and female, and we've got 1970 and 2020. So health changes, what might affect the change from 1970 to 2020? Milestone 1. And be sure to read my module announcement. I attached for Module 2 the final project template, and you can use that for both milestones 1 and 2, and save that work for your final project. So the template will help to ensure that you're covering all the prompts. So final project guidelines and rubric is looking at the whole 9 yards. So milestones 1 and milestone 2. So then the final project. So 3 different assignments. And the second link here under 2-2 is the list. 3 articles to choose from that you'll be working with over the term for your milestones 1 and 2, and then final project. So we can click on the link there in this study, and you can save the paper by looking for the PDF. Here it is, View PDF. So you can click on that and save it to your computer. And here's the abstract. It'll give you an idea. See if you're interested in that paper. And the second one is here. And that PDF is over here. And the third one is this one, and it's paper, it's PDF, even the abstract does not seem to be there, so I attached that paper, that PDF, to my module announcement. And milestone 1. So prompts, see how they're bolding the keywords? So that's what my template is trying to guide you and help you to do the same, so that you can keep track and I can keep track of what you deserve credit for. Purpose of the study, and don't forget the research question. Sometimes can be gleaned from something as simple as the title. And hypothesis, that's different than purpose. So if the study is on comparing treatments for high blood pressure, that would be the purpose of the study, to compare different treatments for blood pressure. Research question is similar but different than purpose. So put this in the form of a question, and you can put it in your own words. It's better to put everything in your own words. That helps you to own the material, so to speak. Research question in my example is treatment A more effective than treatment B in reducing blood pressure in patients with hypertension? Hypothesis is an assumption. So an example in this example of a hypothesis in my example of a study here on hypertension. Hypertension is a fairly common condition, and it's important that we have effective treatments for that. So that it's a statement. So you can see how that's different, an assumption different than question and the purpose. Is the study have an experimental or observational design? A big clue for experimental is whether the patients are randomized into different treatment groups. Observational, that's sometimes called real-world research, like in the doctor's office, they might have a study going, or in the hospital, but patients are not randomized to different treatments. The doctors are carefully thinking about the best treatment for this patient and the best treatment for that patient. They're not flipping coins. Methods to collect the data is different than methods to analyze the data. Collection of the data, example of that, blood pressure. Using a cuff on the arm would be an example of data collection. Calculating averages and doing tests to see if it's statistically significant, that would be data analysis, and that's in milestone 2. I mentioned that for milestone 2 because the two are often confused. Data collection is different than data analysis. Another example of data analysis, the researchers use charts and figures to present the data. Quantitative or categorical data. Quantitative is lots of possibilities with the numbers, like blood pressure, lots of numbers. Temperature, height, weight, even GPA. You might think, 0 to 4, that's not many numbers, but when we have 2 decimal places, that is a lot of numbers. Categorical, not many possibilities, like male and female, or eye color, brown, blue, so limited number. Yes, no answers on a survey would be categorical, and the survey would be another example of data collection. Weaknesses of the data collection was the blood pressure cuff. Has that been tested? Is that particular brand been tested for accuracy? Did the research paper mention that? If you didn't see that, you could say, well, I didn't see that, it mentioned it. And the rubric is similar to what we have up here in the prompt. It matches it. And the homework. So Wiley homework. We can click on homework. And we'll continue. Once you get the Wiley's signed up for that, open assignment. So each module will have its homework, except module 8 I don't think has, so we'll give you a little break there. And if you have questions, feel free to post them in the discussion area. Under general questions. So I'm subscribed to that. I check this daily. I like your questions here. You're welcome to send me an email, but the benefit for posting them here, your classmates can see the Q&A. But certainly feel free to send me an email, and I'm available by phone. If you wish, we can just send me an email. We'll set up a time. And thank you for watching.